Hello guys. In this video I'm going to talk about the NBEMS Diploma Practical Exams. I know that you're going to have your exams in another 12-13 days. So I've done a bit of research. I've spoken to a couple of students who cleared the NBEMS Diploma Practical Exams from the first batch as well as the second batch, and I have made some notes and I'm going to discuss those with you. At the very foremost, I would like to congratulate everyone who has cleared their theory exams. We know how difficult it is to clear the theory exams in NBMS Diploma. In the first batch, I think the pass percentage in theory was approximately 20%, something around 18 out of 87 cleared. In the second, the pass percentage improved marginally, it was around 30 to 40%. And in this third batch, the batch that's going to give exams practicals soon, in them also the pass percentage was something around 35 to 40%. Now, I think the exam is on August 10th or 11th, if I'm right. So, when it comes to practicals, what my research says after talking to a few students in the first and the second batch, that it is not going to be as difficult as your theory exam. Generally, the examiners are going to be kind and pliant and they are going to help you clear the exams. This is the impression I got from these people. We can't be very sure. This is DNB National Board that's going to conduct it. So, sorry, this is NBE, the National Board that's going to conduct it. So, we can never be very sure of anything at all. But however, because they have filtered out a lot of students in the first exam, that is a theory exam, and whoever is coming for the practical exam are generally going to be decently equipped, I think it's not going to be a very difficult job for you. Now, that being said, you might get some perks during your exam. That is, probably they'll arrange for breakfast and lunch. So don't worry about that. That again, you have to have your breakfast and come. Don't take it for granted. Now, talking about the exam, the pattern is generally a long case and two short cases and quite a lot of VIVA stations. Now, the impression I got from the students who cleared their exams before is that the number of VIVA stations may not be fixed. So I'll delve more into this in an order. The pass percentage, yes, we know that in the first batch, out of 87, only 18 or 20 cleared the theory exams. However, out of the 18 or 20 who gave the practical exams, only 2 of them failed. That means the pass percentage in practical exams is pretty good. It's not very bad. It's not bad at all. Whether there is any OSCE, objective structured clinical examination, I don't think so. It was not there in the last 2 exams, and for all practical purposes, I think it will not be there in this practical exam also. The total marks is 300 and you need to get at least 150 to have a clear pass. The long case. Generally, in the last 2 years, the long case typically has been an unsafe chronic otitis media, a squamosal disease or the atticoantral disease. So make sure you know everything about the long case, the chronic otitis media unsafe variety. Now it actually depends. If at all in the center you don't have such a case, they might be forced to keep a thyroid or a larynx case also as a long case. So just don't take it for granted that it'll only be a long case. It'll only be a chronic otitis media case that will be the long case. It can be others also, but generally in the last 2 exams in almost all the centers, it has been a COM unsafe variety that was kept as the long case. Short cases. In the last few exams, a lot of short cases have been kept. So you have 1 long and 2 short cases. So you can expect short cases like tonsil, deviated nasal septum, antrochoanal or bilateral nasal polyposis, ethmoidal polyposis, submandibular gland swelling, neck swelling, thyroid swelling, cancer of the buccal cavity, cancer of lip, cancer of larynx, the safe variety of chronic otitis media, perichondritis, peritonsillar abscess, post-auricular abscess, cleft palate, remnant perforation after surgery, external ear canal polyp, mandibular fracture, and submandibular abscess, Ludwig's angina, etc. Generally, they are not going to keep a very acute case because the patient will be troubled. So you may not get submandibular abscess or Ludwig's angina or peritonsillar abscess, but even if you get, you should be able to answer well and justify it. You need to understand that when it comes to the VIVA stations, they have to cover a certain part of your, there are few things that they have to cover in the VIVA station. One is your otology or ear VIVA. then it is a rhinology or nose viva, then it is a laryngology or head and neck viva, and last it is the recent advances viva. So these four viva stations will be there. Now, in one of the centers, what happened was, along with these four Viva stations, there were four other Vivas as well, like instruments, audiology, radiology, and wet or gross specimen. So what was happening is, along with the recent advances, they kept the radiology. Along with laryngology, they kept instruments. Along with rhinology, they kept um, the instruments part, something like that. So four: ear, nose, throat, and recent advances, and instruments, audiology, radiology, and gross specimens. Now, what we don't know or what we have not spoken here is the histopathology, microbiology, and osteology viva. In the last two exams, they've not had histopathology, microbiology, and osteology vivas. So, less chances that you might be getting this in your practical exam. But we have recorded a lot in Slayer videos, so do not miss out on these things, lest they should keep something and you don't know. So, better be prepared. At least glance through these things once. Depending on the time available and the availability of examiners, these stations may be combined or done together. Like I said, various permutations and combinations are possible. Actually, I spoke to a student where they had only four vivas, and these eight things were covered in these four stations, two in each station. Whereas I spoke to another student where she had actually about six viva stations, and various things were covered in different ways. So it depends on the availability of examiners. But what is fixed is that you will have ear, nose, throat, and head and neck four stations for Viva. Along with that, they have to discuss instruments, audiology, radiology, and gross specimen. Please understand that rather than being scared of Viva stations, be calm and try doing your best, because this is the area where you are allowed to talk, you are allowed to speak. So you will be able to bring things the way you want. You speak the right stuff, they'll ask more questions on that, so you will be able to drag the discussion to an area where you know stuff, you know better. If they are asking you about some hi-fi instrument, surgical instrument, and you have not seen it, try to politely and respectfully tell the examiner that in your particular hospital you have not been exposed to that particular surgery. Say for example, they are asking you about some image guidance instrument or a co-blator or a microdebrider which you may or may not have seen. You can tell them politely, sir, in my hospital, which is a district hospital, I have not seen this instrument. They have not done surgeries using this. It was a classical routine cold steel instruments that they were using. Powered instruments were not there. So, but if you are able to identify it and speak about it, that's well and good. But otherwise, they are going to understand. That's the impression I got from other students, that these examiners are kind of kind. So if you tell them that you're from a district hospital and this particular hospital you were not exposed to a particular type of surgery or these hi-fi instruments, they will understand. So they might ask you to pick an instrument that you know, and then you can pick something that you know and you can discuss more about that surgery. You must know a little bit of everything. It's not necessary that you should know everything completely well. That's the impression I got from these students who I spoke to. They say that they're not expecting you to answer each and everything that they ask, but you should not create any blunders. But at the same time, you should know a bit about everything. Say you get a case of, say, peritonsillar abscess or something, or a tonsil thing, and you must know quite a lot about it. It's not like you can escape without knowing anything. So about all these cases and about everything in ENT, you should know something. There, the difficulty level definitely has to be kept less than a final DNB practical exam, because this is an NBEMS diploma exam. So they are also mindful of that. If they ask you something heavy or something really hi-fi and you don't answer, probably they might not take it very seriously. They might take it lightly and they might ask you something else. But that's not for granted. That's just based on the last two exams. We don't know how it's going to be in this exam. But in all likelihood, the difficulty level will be less than that of a DNB final practical exam. So just try to know something about everything so that you don't miss anything outrightly. And see, in all these practical exams, basically it's about how you talk, how you present yourself. So you have to drag the conversation to an area that you are confident about. Say in a CSOM, you don't know much about perilymphatic fistula and the direction is going towards that. You try to divert it and bring it something more towards the surgery or more towards the clinical findings where you can speak more. So this is a discussion. So they'll ask questions, you will answer. Based on your answer, they will throw more questions. So you have some control over it. For that, you need to know something about everything so that you can try to divert the conversation or the discussion towards a topic that you are more thorough. In audiology, with what I discussed with other students, they kept a few audiograms, Puritan audiograms, and a few tympanograms. So in audiograms, you have to know about conductive hearing loss, mixed hearing loss, presbycusis, Meniere's disease, otosclerosis, noise-induced hearing loss, and the salient features of these things, and how you treat and what the patient presents with. In tympanogram, it's not very difficult. Tympanograms are easy. You've done it in your undergrad as well. A curve, AS, AD, B, C, D, E, whatever it is. All right. What I did not find in audiogram station is any student saying that they were shown a graph of electrocochleography or CC or ABLB or BERA or ABR or ASSR. But do not ignore these. Just understand that if you see a graph with a summation potential and an action potential, this is most likely an electrocochleography. If you find some percentages and increase in loudness or something, it could be ABLB or CC test. And of course, you will know to identify a BERA graph, you have to see the wave, fifth wave, which is the most consistent wave in BERA, and ASSR also. Just have some knowledge about these things as well, so that if at all they are kept, you are able to answer and defend. In gross specimens, generally the students said that they got thyroid or laryngectomy wet specimens. So you should know about these, you should know how to identify and probably find out what pathology and what staging in that specimen is. Likewise, they might ask you about TNM staging in cancers. They can go anywhere from cancer, it's a huge topic. So it's not possible to know everything and learn everything in the 2 years of DLO that you had. So you have to know a bit, not a lot, a bit, so that you're able to answer something. If it's going to an advanced level and you're not answering, that's okay, but at least the basics you should know. The surgery name, the basic steps, what a little bit about recent advances. You have to reach the exam center a couple of days prior. This is because, say, most of us have to travel from some other place. We might have to book our flight tickets or train tickets. So reach at least a day or a day and a half prior, so that you have a good day before the exam where you can rest, which you can revise. If possible, post lunch, try to visit the exam center and try to get a sneak peek of all the cases, if at all that's possible. In radiology, they have kept x-rays, maybe x-ray mastoid, x-ray of your PNS, and also CT scan. CT-PNS and HRCT temporal bone were very well kept. So you should know everything about CT-PNS and HRCT temporal bone. These videos have been recorded by me in the SLAYER course, and I've discussed quite a lot about how to identify the pathology and the normal structures in CT-PNS and HRCT temporal bone. Do not neglect this. What I did not find is a CT neck or a contrast enhanced CT neck or an MRI or any other investigation, say something like your fluoroscopy or functional endoscopic evaluation of swallowing, or such investigations were generally not kept for DLO. But it is prudent to know a little bit about these as well, lest they should keep these and you have to answer, right? So at least know a bit about these things as well. But definitely CT-PNS and HRCT temporal bone absolutely needed. You quickly go through all the SLAYER videos so that you are able to speak something. There is no OSCE, so that's whether it's good or bad, I don't know, but at least for DLO, OSCE is not there. Histology, microbiology, and osteology stations or VIVAs were not there. But during the discussion of your long case or something, if a rhinosporidiosis case comes, they can actually go into the histomicro part of the topic. So do not entirely neglect it. At least the basics and the important stuff in histo and microbiology, please try to revise and go. You have 10-12 days time. You should be able to do a good job if you go through all our videos. Keep revising everything. Stay calm. Answer whatever you can. Do not make any obvious blunders. Read well about recurrent laryngeal nerve, facial nerve, and the surgeries which affect these nerves and how you have to be careful. A little bit about recent advances are also needed. Try to speak about recent advances if they ask you. It will be fine and you will do well. You all have cleared the theory exam, which has been a very tough filtration, and only the cream has actually cleared the theory exam. So you have it in you. You guys have to be confident, revise everything, stay calm, and answer confidently. An important thing, whenever you meet somebody in the station or a VIVA station, please do wish them, whoever is sitting on the table. Good morning, ma'am. Good afternoon, sir. Good afternoon, sir. You keep wishing them. At the end of the discussion, when your time is up, you have to tell, thank you, sir. Thank you, ma'am. Be very polite. Be very humble. Be very calm the whole time. If you are calm, you will be able to answer better. If you are frustrated, if you are worried or scared, then you might even forget things that you know. So this is very important. Be cordial, be humble. If during a discussion they say something that you're wrong, you're doing it wrong, you've said something wrong, please accept it. Do not negate or do not argue with the examiners. That's the main thing. Generally, they said that there are four examiners, one from the institute, one from a peripheral center in the same state or province, and two others from different places. So it's going to be fine. Just be confident. You guys have all read our mastery course, and many of you are using the Slayer videos also. Brush up through all the Slayer videos. Do not neglect anything. Pay attention to all the important cases like COM, squamosal, COM, and all the other short cases. And think a moment and answer very confidently. You will remember everything. All the best to you guys. Thank you.